So we have all of these aspects involved in aging as well, because stress affects our aging, and obviously the effects of stress on our body, and then the body function aspects of as that body function changes, it then affects your ability to cope with daily life and things that go on, and can affect things like, here's one for you. If your thyroid is affected by stress, then your thyroid function may reduce, right? So say your thyroid function drops, then that affects your calcitonin, which is a thyroid hormone. Calcitonin affects the down regulation of calcium being pulled from your bones. Therefore, you can end up with more calcium being pulled from your bones, which means that your bones then decay at a more rapid rate. Therefore, you're seeing acceleration of aging due to stress. Just one example. All right. So, got deep very quickly.
Yeah, no surprise.
So, Loretta, why don't we just go ahead and jump into talking about massage as well?
Okay, how fast do you want me to jump in? Fast or slow?
Just don't jump in.
Okay, just a question.
Truth or myth? When people are sick, or they have a cold, or maybe they don't even know they're sick, but they go and they get a massage, and then the day after they go home and they're extremely sick. Is it true that when there's things going on in your body, you go to get a massage, it just can open up that whole can of worms and you get sicker?
Yes, you never want to get a massage if you know you're sick or have a fever, because that could hospitalize you. But if you don't know you're sick, or you have a lot of like lymphatic toxins in your body that need to be flushed out, that's the initial side effect of massage. You can get sick. And a lot of that too depends with the whole, drink water. A lot of people are like, oh yeah, I drink water. No, a half cup does not do it. Double or triple your normal intake after a massage for a day, because that will help flush out the toxins out of your body so you don't get sick, because they can go in your stomach. They can go in your intestines. So yeah, you can get sick from massage.
Mm-hmm. Yeah, it spreads the lymph. And what's in there, may spread the disease, whatever it may be.
But it's not your fault.
No.
Not the massage therapist's fault then.
Of course not.
And because there's this whole myth about that. And I say this because I've spoken to 3 different people that are a little older that could definitely benefit from going to get a massage with a certified massage therapist. The first thing they say to me is, oh, I did that once and they got so sick, or so-and-so, and they died. And so that has nothing to do with the massage therapist. It's something that
has everything to do with the individual.
Yeah, even if you're on medications, you can't get a massage. A lot of massage therapists overlook it and they're like, yeah, whatever, I've given you a massage before, no big deal. But if you're on painkillers or something for fibromyalgia or blood pressure, you cannot get a massage because it's a contraindication, which means basically you just can't do it. You'll get worse. It'll make everything worse. You'll start throwing up, run in the bathroom constantly. It's not pretty.
And that's almost a disclaimer on massage. And so let me throw in the disclaimer. We're not trying to treat anyone, obviously, over the air, and we're not trying to cure or prevent disease, right?
Right.
But it's good to bring up that there are aspects that have to be considered. And that's why you need to be dealing with a professional, not just some
Joe Schmo off the street.
Yeah, I see this. There's a fair amount of this going on, where somebody who's not trained in massage does massage of people.
Or they're trained in it and they're new and they didn't go to a good school that gave them enough proper training, so they don't really know what to do until they've had the experience or somebody has to retrain them. That happens as well. I've run into that myself, and I get very hypercritical.
It's unfortunate, and you are one of the better massage therapists.
Thank you. That's why all the celebrities love me as well.
Yeah, you're very, very good massage therapist, and very, good on finding the areas that need work and that kind of thing, and working them. And yeah, you are a massage therapist to the stars as well. I know you've massaged a lot of different celebrities, right?
Yes.
We won't mention all their names, I guess. Because
No,
some of them
HIPAA.
probably want to keep it private.
Yeah.
And okay, so all right, so we want to incorporate what we've been discussing, which includes that stress affects your aging, and so we don't want to get too stressed about these subjects. So we'll go ahead and take a break.
Relax.
Yeah. All right, you're listening to A Path to Wellness. Yeah.
Attitudes are contagious. Is yours worth catching? Yes, it is. I like the how it's over those.
We like listening to those waves. And it feels pretty good just lying there listening to the waves and hearing the seagulls in the background and feeling the little bit of a breeze on our faces, right? As we sink into the sand, sinking into the sand, feeling that soft sand below us and relaxing our feet and our calves and our thighs, relaxing our buttocks and our lower back, just letting it kind of pooch out a little bit and fall into the sand. Our torsos and just letting our shoulders fall and relaxing our head and our neck and our jaw and our eyes. And our eyes start to relax as we lie there in the sand with the waves and the seagulls in the background and the breeze and smelling that salty air as we lie there, enjoying, feeling a little bit of sun on the side of our face as we lie there, just relaxing, enjoying the waves as the waves push up onto the shore. You're hearing the birds in the background, seagulls. And the eyes get really, really heavy. As we feel heavy, we feel like we can't even move. We can try, but we can't. We can't move because we're lying there, falling into a deep sleep, becoming so relaxed. So relaxed. It's a pleasure just lying there in nature, feeling relaxed and calm. Listening to those waves in the background, pushing up to the shore, feeling the breeze and smelling the salty air. Enjoying listening to the seagulls in the background and ignoring any electronic devices that might be in the background buzzing at us or any of that stuff. Just fading into nature and enjoying the breeze and the waves. So that little thing I just did was an example of guided imagery. It wasn't totally involved, but that was an example. And basically putting yourself in a place that you like. For some people hate the beach. Some people don't like the beach. Some people would rather be in the woods. Some people would, actually I've had this, would rather be at their desk at work or sitting in their living room.
You put me to sleep almost. And I'm not one who likes to be.
So it takes, you can figure out what it is you like that makes you feel more relaxed and happy and in a good state of mind and energizes you perhaps. And put yourself there. And when you put yourself there, you don't just say, okay, I'm lying at the beach, right? That doesn't do anything for you. But you want to bring in all of your senses. So you feel the sand, you feel the breeze, you hear the waves coming up to the shore. You smell the salty air, and you listen to the seagulls in the background, and you feel the warmth of the sun on your skin. These are getting various senses in there. You could even maybe taste the salty air. You can taste the salt on your tongue as you breathe in the salty air and smell the salt. And then feel the soft sand on your body as you sink into it. And it customizes itself. It wraps around you, wraps around your body. It's like one of those Tempur-Pedic mattresses, right? You sink into, but don't get a Tempur-Pedic mattress. They're full of formaldehyde and garbage that you're breathing in overnight. But anyway, just throwing that one in. But you're sinking into the sand. You feel yourself sinking into that sand. And feel the breeze and smell the salt and taste the salt and hear the seagulls and feel the breeze on your face and feel the sun on your face. And relax your muscles as you progressively relax from your feet all the way up to your neck and your head. Just one part of your body at a time, relaxing as you go. Okay. Mm-hmm. So that's what I was drawing into that guided imagery, right? That kind of sequence. But if you don't like the beach, then put yourself in the woods, say. You're in the woods with all the trees surrounding you, right? And the leaves, and you can smell the pine, or you can smell, the scent of that bear charging towards you. No, that doesn't exactly relax you.
You're seeing the nature come all around you. You're like Snow White.
Okay. So what did I just do, though? I brought in a response called the fight or flight response. That's the adrenal response. That's stress, you see? So that's just like the response we get when we deal with the situations we deal with every day in running a business or in doing projects or meeting deadlines or all these kinds of things, all the stressors that come up in our life on a daily basis, and in some cases many, many times a day. And each one of those stressors can really change our process of aging.
Mm-hmm. I think I
Really?
just aged about 3 years because of all my stress I had with these darn
Accelerates.
schools.
Oh yeah, that's right. Yeah, dealing with all of the trying to get certain paperwork done and all that stuff.
Yeah.
Yeah.
But we won't go there.
Well, actually, we can go there. What's stressful about that?
That they penalize you for their mistakes.
Yeah.
Meaning,
Well,
you turn in everything for financial aid, you turn in everything for the admissions. Here's the start of school. They tell you, oh, we're sorry. You can't start now because we made a mistake. But it's your fault too. That's how they try to throw it back at you. But if you have a mouth like me, you're going to give it to them.
Mm-hmm.
But, you know, it's totally stupidity and like totally unnecessary.
Mm-hmm.
You know, don't penalize a person for your mistake. So that's really stressful, trying to get everything in. And then you fax it over 16 times. And then you email it 16 times. And you put it in their system that they tell you to put it into digitally. And that doesn't work. And then you find out a week later it doesn't work. And it's like, oh, really?
Mm-hmm. That's frustrating and it's stressful and it's aggravating.
Oh, by all means it is.
Yeah.
And then you waste all this time and effort. And then you're like, for what?
Yeah. Yeah. And certainly putting the time in for something and not getting the end result that you're looking forward to is hard. And it can be stressful.
Oh, yeah.
You know, in the Buddhist philosophy, there's this view that basically, cutting it to the chase, life is suffering. And this is kind of the stress we go through, is the suffering of being stressed
Mm-hmm.
on a daily basis. And particularly in the U.S. The U.S. lifestyle and the U.S. society is set up in a very stressful way.
Because we don't know how to relax.
True.
That's why when we go on vacation, we pick places way up in the mountains where there's landlines, no internet access at all. So you can actually unwind. After a day or two, you're like, oh, my cell phone isn't blowing up. I don't really care about the world of Facebook. It's pretty boring anyways, Facebook. I'm kind of over it. But you know, and it's like, you need to find you, and then you need to like just go ahead and relax with yourself or with your friends and family, whoever you're on vacation with, and just take a freaking breather.
Mm-hmm.
Please.
And find your center. Find
Exactly.
you in all of that.
You know, get it, like we always go to West Virginia every couple of years. We get a nice cabin, it has a fireplace, there's wildlife everywhere. It can go all the way on a horse ride for 3 hours to the top of the mountain and back down, and it's very relaxing. Unless your horse is, you know, kind of crazy.
Yeah, I had one try to rub me off on a tree one time.
Yeah, she kept trying to rub me off and then dipped down the slope, and I would have fell about a good 8 to 15 feet. She was abused though, and really was getting weaned in. But I had to
you got a
be the one
stressed
that
horse.
yes, that. And then she kept nipping at the bum of the horse in front of me, and it was really annoying. And she would just stop.
So what effect do you think stress has on us biologically?
Oh, everything. You know, it can change our physiological end of what we are. You know, it can put stress on our organs, on, you know, our brain, just our everyday life, as you were saying, you know, because we have to take a break. And
Yeah, so we have this gland called the adrenal gland.
of course.
Yeah, on each kidney, right? And so you get this adrenal response. And that's producing hormones like adrenaline and
Mm-hmm.
cortisol, right?
Yes.
And there are different kinds of cortisol, mineral corticoids and glucocorticoids.
I didn't get that in depth in school.
Yeah.
From what I can remember. This is why you're here.
Okay. But so those hormones crank us up, get us ready for for fighting that bear in the woods.
Right.
See?
Which initially could put adrenal stress on us.
Right. And so we're fighting these bears all day long, dealing with these things. And then our cortisol levels and adrenaline levels are going up. And so we're releasing sugars into our bloodstream from the glucocorticoids. That sends us into a cycle where if we get a real spike in stress, then we're getting a real surge of sugar. There's a purpose for that, because that's part of where you get the energy, along with the adrenaline, to motivate you to get out of there if you see a bear, you know.
Yeah.
That's where that comes from. But having that sugar surge into your bloodstream then can cause an insulin response that spikes. And that insulin response is very damaging when it elevates, and it can reduce the oxygen transfer from your bloodstream to your muscles, and actually over a longer time period can weaken and damage your muscles. And it really can affect you long term. So the damage on the muscles is interesting. You get into neuromuscular massage, and you mentioned fibromyalgia.
Mm-hmm.
Chronic fatigue syndrome is another issue tied to fibromyalgia.
I think you've told me that.
Yeah. And so we have CFS, FMS, right?
Mhm.
Chronic fatigue syndrome and fibromyalgia syndrome. And quite often, and I think generally speaking, chronic fatigue relates to adrenal fatigue. And so we have adrenal fatigue due to overactive adrenal response, due to too much stress, damaging our muscles, essentially. And so we have this issue with fibromyalgia. Do you see the connection?
Right.
Yeah.
Right.
Yeah.
That brings me to the massage end with
Mhm.
the fibromyalgia.
Yeah. And there are lots of studies showing very good benefit from massage and acupuncture in fibromyalgia.
I did my own little study up here in my head when I worked at a big chain corporation. One of my clients would see me once a week because she wanted to get off the pain meds for the fibromyalgia. And she noticed that certain parts of her body would get bruised, even if I would go light, but that was the side effect from the medication. So it wasn't me. But she noticed she didn't have pain for like 4 days. Some days she would be pain-free for 2 days. But when it was really bad and it flared up, I would just go so gentle, almost like I was just touching a newborn baby's skin, just really soft and gentle, because I didn't want anything to flare up anymore. And that actually helped her go pain-free. She'd wake up in the morning and she's like, oh my gosh, it's crazy, but I feel great.
That's awesome.
So
yeah.
I started working with her about 4 months in a row, weekly.
Yeah, definitely. There's a lot of benefit there. A lot of benefit.
Oh yeah, absolutely.
And so that is an aspect of anti-aging, is reducing your stress. It's very, very important. It is shown that, well, let's put it this way. I've seen clinically the effects of stress on an individual. And I can give you a wonderful example. When I tested the telomeres, which are basically the tail or the section of DNA where there's storage of the components that are used to make the DNA to reproduce it. And as that tail shrinks, that's one of the indicators of age. And when it finally runs out, then that's when you get apoptosis, or a form of programmed cell death due to running out of that material. So stress.
Is that what apoptosis is? I forget.
Yeah, it's programmed cell death.
Okay, all right.
Apoptosis. And so stress, from what I've seen, and I'm sure there's quite a bit of study on this as well, has an accelerating effect on the shrinkage of telomeres. So there's a very aging effect with stress. A true aging effect. So part of anti-aging is, first of all, to get the aging at bay, right? To halt or pause or reduce the acceleration of the aging. Then you can start to work on really reversing some of the effects of aging. But it's certainly important to start off by getting that a handle on it, basically, right? So I don't know where I was going with that, but there we are.
Yep, you kind of get lost in your own translation a lot, which that's okay because that's how your brain works.
All right, so you were going to
talk
go
about
over
massage therapy.
some of the benefits of massage. Let's go ahead and get into that as well.
All right, so it can help boost your immunity if you keep up with it like every week to 2 weeks. It's, you know, your massage therapist will say, come back and see me again in a week. It's just not for them to make money. It is really, truly for your benefit. I start off by seeing all my clients once every 2 weeks so I can note the changes. I tell them, come see me every 2 weeks for 2 months. Then we'll reduce it down to like 1 time a month, or we'll still keep it at 2 times a month, depending on the changes of your body, the physiological, the pathological, everything, you know. It does,
response.
Yeah, your response. It does really, you know, it improves your balance. It does because, you know, like we have our erectors muscles, there's 3 sets of them, they're attached to our spine. So if you peel back the skin and a couple layers of muscles, you'll see the middle or the last part of them looks like angel wings. Well, those still attach to everything. So, you know, we're going up and down the spine using our techniques, our long strokes and all that. Eventually, all of that muscle and aponeurosis, which is our fascia, which is all over our body, that will release, making us longer. It will help release some of the tension in the tendons, some of the tension from the deeper muscles that have the ligaments attached, because the ligament attaches to bone, if you don't know that.
And that can be a very important aspect because,
absolutely,
for example, if somebody has disc degradation in their spinal column,
it can help with degenerative disc, like ease the pain, but it can't repair the disc.
Well, it helps your body repair itself because you're allowing the relaxation of the muscles, and therefore the discs, the vertebrae can spread more naturally,
right,
and take that pressure off the discs and allowing
but that
the
takes
discs
time.
to function.
That would be a good therapeutic medical massage.
Over time, yeah.
Over time, yeah. And, you know, and massage is just not one quick fix either. You know, you have to get it in sessions. Again, referring to something from my past, this former client of mine, now this is when I first started massage therapy. I maybe had about 5 months of experience, and, you know, I went from school, worked at a chiropractor's, worked at a spa. Well, the client was seeing me at the spa. Nobody ever worked on her glutes. No one. She gave me permission to work on her glutes, to work on her hamstrings and her quadriceps. And do you know, she came back the next day and hugged me and just loved it so much because I was the one that took her out of pain. After 10 years of going through massage therapists and chiropractors and massage therapists again, you know, she didn't find the right one. There would be a therapist, yes, that would be very beneficial to her, that would help, but they would be chicken and not work on her glutes, you know, your rear end. And you need that. That's a part, that is our muscle. That controls some of our lower back muscles, that controls our leg muscles. You know, all of it's attached. So I fixed her. And that was a great feeling that I helped her be able to maintain a normal lifestyle. She could sit longer.
Was the pain in her glutes, or was it actually in her lower back?
It was all over, because she got into a bad wreck and it mangled her. And over time, you know, she had to get surgeries, you know, so when you slice, you know, it shortens the muscle, shortens the ligaments, tendons, yada, yada, yada. But
that's not good.
Wanted to live a natural lifestyle and not be on medication. So, you know, when she got well enough past the physical therapy part, that's when she started seeing a massage therapist. And she, I think, if I don't remember, it was about 2.5, 3 years ago, I think she said she wanted her glutes done, but a lot of therapists wouldn't do it because they were chicken, or it was like, you know, their comfort level. Me, I don't care. You give me your permission, I'll massage your glutes. And that helped her. It released everything.
Right. Because there would be a lot of tension. What I was thinking was along the lines of the SI joints, you know.
Yeah, well, that's what I think she got pelvic damage.
Mhm.
So, you know, all of that. I mean, she had a long health history.
Mhm. And taking the tension out of the muscles in there allows relaxation, and some of that connection is to the lower back area, pulling on that lower back area,
Absolutely.
adding to perhaps the protuberance of the lower back or SI joint area.
Uh-huh.
Which basically, then that can even then go into affecting the hip action and so on.
Yes, absolutely.
Right.
Yeah.
Yeah.
Yeah. Yeah.
Mm-hmm.
Yep.
Great.
Let's see.
What else
Well,
do you
there's
have?
a release of, you know, we went over that helps fibromyalgia. You can sleep better, eases symptoms of depression. I've seen that too. Here's my favorite. Improves cardiovascular health,
Mhm.
which is true. Because I was taught in the school I went to go centropedial, which is towards the heart.
Mhm.
Move everything towards the heart because it helps, you know, fill, you know, the way the blood pumps and everything, you know, and it just helps with the circulatory aspect of that. That's my best way I can explain that. Yeah, here's another one that I learned. Reduced osteoporosis, decreased stress in cancer patients, temper effects of dementia, decreased carpal tunnel, which is commonly misdiagnosed as well as sciatica, but that's for another day. If you have joint replacements, you can get massage. You just got to let somebody know, okay, I've had a joint replaced, so you don't pop that joint out of place and have to go through surgery again.
Of course. Yeah.
You know, and be open and honest with your therapist. It increases your range of motion. One that I learned was a stretching technique. It took me 15 minutes to stretch each limb, both arms and both legs. You know, half the class did it, and the other half of the class didn't get to do it until the following week. And it literally is so meditative and so calming. You do notice the difference right away. Like with me, I had all these problems, so they did half of my body just to see. So 15 minutes one arm, 15 minutes leg on the same side of the body. The other half they didn't touch, and I noticed a difference, and I was off balance. And it can grow. You can actually get an inch or two taller, you know?
Kind of like being on an inversion table.
Absolutely, you know, improve quality of life in hospice care, reduce chemotherapy-related nausea. With that, though, yeah, I agree, but if you are getting chemo and it's a small dose, I don't recommend, you know, getting a massage if you just got out of chemotherapy and have been radiated, because everybody in that spa will get that radiation or massage therapist, you know, and you can't really get a massage if you've been fully radiated. You have to wait until you're cleared from the doctor. That's what I recommend as well. I will not work on a patient who has any type of radiation, but as long as they're cleared, the doctor says it's okay, then I will work on the patient.
And there are lots of approaches naturally that can help with the side effects of chemotherapy.
Mm-hmm.
Particularly some Oriental medicine works really well in that area.
Of course. Yeah, it does. I'm the massage therapist in Dr. Jackson's practice and at a Path to Wellness, and we refer back and forth. Sometimes I notice that his patient will do better getting acupuncture first and then massage therapy, or vice versa. It's just the way our bodies tend to be, you know? Like with chiropractic massage, sometimes I'm the way that most people are. I have to get a chiropractic treatment. No, I have to get a massage first, and then I can get the chiropractic treatment because I'm too tense getting treated, and it's harder for me to get adjusted. As where if I get the 15-minute or a half-hour massage before I go in for the chiropractic adjustment, then it's just easier. Crack, crack, pop, pop me, I'm good.
Mm-hmm.
You know, and it's a less of a struggle. And I noticed that too because your muscles also relax better after the massage and chiropractic treatment. You're still going to get those spasms, which is natural and it happens. and it's nothing to freak out about. I tell everybody, you know, you're going to have spasms, you might feel nauseated, you might vomit, you know, so take what I tell you personally, you know, drink the water for the next 24 to 48 hours, double. You know, it is my suggestion on that because you will get sick.
Mhm.
Okay, anything else? I think I went in too fast and too much depth.
No, that's great. That's great. And I think there's a lot that people may not be aware of about the effects, the positive effects, the benefits of
Mhm.
massage. And
Like planning your vacation, get a massage on a vacation. If
There
you're
you
not one who likes massage, get a facial, get a pedi, get a mani.
yeah,
And men can do it too. They can get a pedicure and a manicure.
and reflexology is another aspect of that.
Yes, that's what I would like to learn.
Massaging the feet, yeah.
The use of warm or hot towels and hot stones. I like to use some of that on certain areas of the body to release some of the tension that won't like release from my hands working in that area. So if I have a hot towel or I have some of my hot stones, put it on that area because that'll release it. The deeper muscles as well.
Yeah, I often see muscle release both with acupuncture and without acupuncture. You don't have to use the needles in this kind of treatment. For example,
You can do acupressure.
acupressure, and there's also electrical stimulation there. A little
There's trigger
pulse.
point therapy, which is not technically a massage. Some people do it different ways. I learned it 2 different ways.
Yeah.
You know.
Yeah, exactly. That's basically a form of acupressure.
Mm-hmm. Which is
So,
amazing.
yeah, it is amazing stuff. I mean,
He's a headache doc.
yeah, for sure. I mean, how many people have you seen me get rid of headaches on? I mean, it's so regular, and it's so simple.
Mm-hmm.
But I've developed a technique over time where I'm not just doing acupressure. I'm developing a technique where I can feel where the pulsations are in someone's
That's
head.
what
I can
you
sense
learned.
that with my hands.
That's what I learned.
And I can tell where their headache is and go right to it. And like where it's being caused, not just where they're feeling it, but where the root of it is, and go there and fix it. That's quite often what happens.
Mm-hmm. Same thing with me. I let my hands be the brain,
Right.
and I just get very meditative, and I keep all the boundaries subconsciously in mind. So I'm not compromising someone, but I just go with the flow. Literally go with the flow of the energy. My body is just drawn to where their pain is. And they might not know a person, they're like, oh yeah, my neck hurts today. I've massaged plenty of people who didn't want their arms massaged. I said, let me try it because I know how the muscles connect. And a brief little explanation will change someone's mind. I worked this woman's arms. She didn't even know her neck pain was radiating into her deltoids.
Oh yeah.
Which are upper arm muscles for those that don't know anatomy.
Yeah. Front or anterior, posterior, and lateral. Yeah. So
He's getting to be massaged.
so we're doing a little anatomy lesson here as we talk for some people, I guess.
It's our body, and there's nothing to be embarrassed about. It's what we are inside.
Yeah, and the physiology involved in that and how it all works, together. And that's the thing about holistic medicine is approaching the whole person, looking at all of the aspects. As well.
I would say I'm a natural pain reliever in a holistic aspect.
Yes, you are a natural pain reliever.
I am.
Yes, you are. She is both our office manager. Actually, I should say 3 things: our office manager, our patient care advocate, and our resident massage therapist extraordinaire. And I mean that. I mean, she's very, very good at what she
He's
does.
making me blush now.
Well, I've had lots of massages, and I can speak from personal experience. You're one of the best, if not the best.
If I had
Sure.
a hydraulic table, I'd be better.
Okay, we're putting in pitch for more equipment.
The
Okay.
$8,000 one. With all the nooks and crannies, no,
Oh,
I'm kidding.
listen
That's
to
too
this.
expensive. I told you
Okay.
I'm expensive.
So there's a lot of issues related to aging, but stress is one of the major factors. And I hope that you've gotten some insight from our show today.
Massage is very anti-aging
On-
as well.
Yes, absolutely. Well, that's kind of
Helps your collagen, helps your elastin.
that's true.
If you've
That's a
lost
different
a
aspect of
substantial
it, yeah.
amount of weight, get a massage. You might be embarrassed for somebody, seeing you, with droopy skin, all this excess skin, but over time, the more massage you get, the tighter everything will become. It's not a quick fix. So it
That's
probably takes
interesting.
6 months, 3 months, depending on the individual.
So you're talking about things like gastric bypass, for example,
Or just
as well.
rapid weight
or
loss.
rapid weight loss. Yeah.
Just boom, 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 boom.
Yeah, I think one of the other factors that, unfortunately, I think a lot of people are given these kinds of operations or lose weight rapidly and don't really have any guidance and don't get proper nutrition while doing that. And therefore, they get more flaccidity, they get more hanging tissues, and so on. With the gastric bypass operation, that's inherently part of the issue because the surgery itself basically causes them to be restricted in the nutrition that they need. And that can be enhanced in so many ways. There are so many things like I use a lot in the sense in our practice of liquid nutrients.
Yes.
Many of those are isotonic as well, meaning that they bypass the digestive process and go right into the intestinal tract and they're absorbed into the bloodstream. Literally within 5 minutes, you can get 95% of the nutrition from these things into your bloodstream and working in your body.
I noticed that with the vitamin D.
Yeah.
It was quick.
Yeah.
Yeah.
And and there are a lot of these kinds of forms of nutrition that can be done. There's a couple of companies I use that are involved with producing this kind of nutrition. It's really the best there is. One of the companies is called PM International, is involved in the production of these powdered forms of vitamins and food substances as well, and probiotics and so on in a lot of what they do. And it's very good. I mean, personally, I noticed the effects on myself very rapidly. And if somebody is going through rapid weight loss, they need to make sure their nutrition is good because they will get this flaccidity unless those muscles and tissues get the nutrition they need to be responsive and elastic, right?
Right.
Then adding in the massage helps to improve that elasticity and the collagen formation and so on,
Yes.
as you said. So the combination can improve the outcome and improve the muscle tone and the tissue as well.
Yep.
Yeah. So anyway, there's a lot. I mean, PM International is one of the companies I use that is very much into anti-aging, and we've seen tremendous results with them in terms of like the Olympic teams. 2010 Olympic team had as many medals as a country, and second in the world. I believe it would have been of the athletes that were involved in that. So that's one of the things that we use to help with anti-aging and so on. There are a lot of things. Antioxidants are very important to address tissue damage, that happens with aging, with sun exposure, things like that. And another aspect of the damage that's done to our bodies over time through free radicals that go in and strip electrons off of molecules throughout our bodies and change our balance. And lots of antioxidants can help to repair that. And the specific forms that we use at A Path to Wellness are top notch. No
Exactly.
question. Absolutely the best. No question. So this is the kind of thing that can help to improve the result and improve aging and reverse aging. So there's many other aspects. We could probably do another 3 shows on it at least.
I think we should.
But I think we can conclude with that show today. So you're listening to A Path to Wellness on rhinoanair.com, WSPF Digital Broadcasting. And you could reach us if you'd like at, first of all, you can see our